Hello, everyone. Thanks so much for being with us today. My name is Elisa Alceja. I'm with Methodist Healthcare Ministries, where I serve as a community impact specialist. A little bit about us. MHM is a faith-based nonprofit organization and co-owners of the Methodist healthcare systems here in San Antonio. With those earnings, we reinvest directly in our communities, whether through health clinics in San Antonio, community-based nurses and behavioral health services, or our strategic grant making across 74 counties. At Methodist Healthcare Ministries, we're really committed to broadening the definition of healthcare. We know that health is about more than what happens in a doctor's office, right? It's shaped by the everyday realities people are facing, like access to healthy food, quality education, and increasing access to reliable internet. Because the truth is that so much of our life today is really happening online, from applying for jobs to accessing healthcare or public benefits. Digital access has really become essential. In fact, about 92% of jobs today require at least one digital skill. But we also know that access alone is not enough. It's not just about having internet. It's about whether it's affordable, whether you have the right device, and whether you have the skills and confidence to actually use it. And that's really where our work comes in and the work that I'm very proud of. At MHM, we are investing in strengthening the digital equity ecosystem across South Texas through grant making, capacity building, and policy and advocacy. At the center of all of this is really partnership. And we know this works. And we know this work doesn't entirely happen in silos. Real impact happens when we work together. I'm especially proud of the work happening through our digital equity cohort. It's now made up of over 35 organizations across South Texas. And so they are really the ones on the ground advancing digital opportunity in their communities. And that's really exactly why we're here today, right? We're here to dig a little deeper into what it really means to live and thrive in a digital world. Even as infrastructure continues to expand, we're still really seeing a need for adoption, for skills, for trust, but I think most importantly, for support. I'm excited to share with you guys some of our cohort members on this list. You'll find some of the cohort members comprised of our digital equity cohort across South Texas. I'm also excited to be joined by some incredible partners who are doing this work every day. With us today as panelists, we have Monica Garcia from MHP Salud, Presley Price from Goodwill Central Texas, and Daryl Greer from Older Adults Technology Services at AARP. And I'll now invite each of them to do a quick introduction and share a bit more about the work that they're leading in this space. Monica, if you don't mind, maybe going up first.
Sure. Thank you. Thank you for this introduction and this opportunity. And welcome, everyone. Thank you for joining us. I'm really excited to introduce MHP Salud, which is a national nonprofit with more than 40 years of experience advancing health equity, reducing barriers to care for underserved communities. At the heart of the work that we do is our community health worker promotora de salud model. That's what makes us different. That's what makes us unique, is that the promotoras are trusted members of these communities that they serve. They share a common language, culture, and lived experience, which is important in building trust and providing education, support navigation, and connecting individuals and families to critical health and social services. Through this model, MHP Salud delivers community-driven programs that address both health and social needs, from outreach and health education to digital literacy and access to care. In Eagle Pass, for example, our digital connection services that are funded through MHM help bridge the digital divide by equipping community members with the skills and tools needed to access and apply to public benefits, apply for jobs, connect to telehealth and financial services, and basically stay connected to their loved ones as well. So in additional to these direct services, we also have MHP Salud partners, and that includes health systems within the regions that we serve, nonprofits, and many leaders in our communities that strengthen our CHW workforce through training, technical assistance, and program development. And so together with this work, it's more about delivering services, but it's also about building trust, strengthening our communities, and creating lasting, equitable change. And that's MHP Salud. Thank you.
I love it. Thank you so much, Monica. I'll invite Presley to do a quick introduction now.
Hi, everyone. I am Presley Price, a Program Services Supervisor at Goodwill Central Texas. I oversee our digital equity grant, Goodwill Tech, which is funded through MHM and serves as our Learn and Earn device distribution program. And I also oversee our career advancement team, where we focus on expanding access to workforce training, digital skills, and community-based services across Central Texas. And for those who may not be as familiar, Goodwill Central Texas is focused on helping people transform their lives through work. We serve individuals who are facing barriers to employment, whether that's limited access to education, technology, stable housing, or other resources. And we provide the training, support, and connections they need to move into more sustainable careers. On the workforce advancement side, our career advancement team delivers hands-on training programs that prepare individuals for in-demand careers. And they also support them while with job readiness skills like resume building, interviews, and navigating the workplace. What we've seen more and more is that digital skills are no longer optional. They are foundational to almost every career pathway. And that's really where my work sits, at the intersection of workforce development and digital equity. Through our digital equity initiatives, including our Goodwill Tech program, we're not just focused on getting people connected to devices or internet. We're really focused on making sure they have the skills, the confidence, and the ongoing support to actually use that technology in meaningful ways. Because access alone doesn't guarantee opportunity. So we work with those individuals who may have a smartphone or even a computer, but they don't feel confident applying for jobs online, using workplace systems, or navigating digital tools that are required in today's economy. So our approach is really about meeting people where they are, building foundational digital skills, integrating those skills into workforce training, and supporting individuals beyond the classroom so they can continue to grow. Our goal is to move beyond just placing someone in a job. We want to make sure that people build long-term stability and mobility in this rapidly changing, increasingly digital workforce. Thank you.
Thanks, Presley. I'll invite Daryl to do a quick introduction.
Perfect. Yes, my name is Daryl Greer. I'm the Regional Program Manager to OATS from AARP, also known as Senior Planet from AARP. Basically, we have about 20 years of expertise helping older adults incorporate technology in their everyday lives, just so that what is it? We're able to live longer. As we see that technology is a social determinant of health, it's basically in everything we do. And then we work with a segment of the population that oftentimes is overlooked, overseen, and underserved. So then we put our expertise in through either our virtual programming, our in-person programming, or a no-cost licensing program in which we work with nonprofit or different types of municipalities to help leverage our programs to serve seniors in not just urban areas, but also in rural areas as well. Thank you.
Claudio, All right, great. Well, thanks so much for those introductions. This next part of the webinar really is just one big conversation, right? I have a couple of questions that I'm really excited to get through, mostly too because I know these folks and I know their work, and so I love hearing more and more about it. But if folks have any questions at any point throughout the webinar, please feel free to drop them in the chat. There's a Q&A box on the site as well. And we'll make sure to get through some of those questions. But my first question here is for you, Monica, right? As we continue to talk about how public benefit adoption programs are moving more and more online, it's also kind of scary, right? And some of these websites are not easy to navigate. And so do you think are digital application systems actually making things easier or just kind of shifting the burden onto the individual?
In conversations with, our field workers, which are community health workers, specifically in EaglePass, we have noticed that there is limited instruction, especially because we service a lot of older adults. And so being able to transition from the regular process of maybe applying in person, which is something that folks are typically used to doing, to a digital service is actually a process, right? And that requires additional instruction. And this is something that our social service systems do not seem to have the time for. And we see that as a barrier for our communities to access these public services. One of the things I want to mention that in conversations with our CHWs is that time is always of the essence, right? And we see also a time inequity. And so what that means to us is that as an organization, we fill that gap because we do notice that a lot of people, specifically in the areas that we serve in EaglePass, that tend to be very rural. We have colonias. If many of you are not familiar with the concept, the colonias are very border region based. There are areas, very rural areas, that are based specifically pretty far away from where the public services are usually provided, or people have to go into town to get these services. And so transportation is always an issue. And of course, as we know, in these very rural communities, also digital access is also an issue. And so what we as an organization have started to do is to create time, right, for people, and so that we are able and accessible. So our community health workers tend to meet people where they are, and that is in those communities that are facing the most disparities. And we're able to help bridge that gap by also providing instruction, because that's something that our social services are not providing. So our community health workers know the community well. They know very much from conversations and working within those communities what are some of the immediate needs. So we started providing instruction on how to access the website, how to download the application, just the basic information, like how to use a QR code. Many of them have never done that. And we started doing that so that they begin a process of the more you do something on a regular basis, the more it gets embedded in our memory. And so, especially with our older adult population, we see that the need of repetitive process to be able to embed that and make it a bit more normalized, because then that bridges, right, some of those divides that we see within our communities, especially accessing these digital services.
Thanks, Monica. I want to switch over to workforce and workforce development. Presley, I think you said it too. And in my intro, I said something like 92% of jobs are now requiring some sort of digital skills. But I'm wondering if we're setting sort of an unrealistic expectation for job seekers when it comes to these types of digital skills.
Yeah, I think in many cases we are. Employers are often assuming a baseline level of digital fluency that not everyone has had the opportunity to develop. At Goodwill, we work with individuals who are fully capable, and they just may not have had the opportunity or had the consistent access to technology or that training. So the issue isn't potential, it's exposure and support. So one of the ways we address this is really by starting with digital skills assessments that helps us understand where someone is coming in, whether they are brand new to technology or just need to build confidence in certain areas. From there, we can really meet them where they are and then set the realistic goals with them and connect them to the right training. Not everyone is starting at the same place, and if we treat them like they are, that's where those unrealistic expectations start to show up. So our focus is on building skills and confidence step by step, like Monica just talked about, rather than expecting immediate proficiency, and making sure that each person is on a pathway that actually aligns with their own starting point and their own individual goals.
Love that. Yeah. Yeah. So important to meet people where they are. Daryl, if you don't mind switching over to older.
Daryl, I'm gonna step
Intimidating
in.
or
Oh, there
maybe
we go.
irrelevant to older adults?
You froze a little bit, but the actual process with it, I would say it's a little bit of both, right? So we are asking older adults to do very complicated tasks via like portals, via different types of like websites, right? But it's relevant. The whole point of having these portals is to facilitate, kind of like what Monica was talking about. It's time. Time is important. And through these portals, we're able to capture great information of health and everything else. But at the same time, if you shift over to a new health system, it's those asks of uploading documents. 90% of older adults, they are using smartphones. 20% of those individuals use the smartphone as their only internet-enabled device. This is a population that has neuropathy. This is a population that has low vision and also many times weak foundation of technology use and understanding overall. Even concepts of cloud storage, that these are foreign concepts, but yet we see it every day and it's vital. Absolutely. I would say that we're asking folks to do very complicated tasks that they may not be prepared for.
Yeah, that's fair. Sorry if I might have gotten cut off at some point or another. Back to Monica, where do you think you see the biggest disconnect between sort of how systems are designed and how people are actually using them?
Mhm. Um, I want to just make note before I answer that question is that there's been a lot of research and studies done on time equity and the inequalities that many people who are experiencing inequities have to go through. And this is a reality that we see in our communities. There's been several studies, especially with the University of Albany. They have a research that was done on examining the inequalities of time and the cost of waiting, right? And some of the things, this is why I wanted to address this, because this is very much connected to our discussion. And one of the conversations that we had in conversations with our community is the time it takes them to apply for any public benefit process. And when you're poor, I know that from my own personal experience, we always had to wait. We had to wait in line. We had to wait for services. I lived in the colonias, and we had to wait for even internet services to arrive, right? That was not accessible immediately for us. And so these are our realities of our communities. And so as an organization, we want to move away from that and show and demonstrate to our communities that your time is valuable, and that in order to do that, we need to provide you with the resources and the services that you need in order to free up your time for what? To even to engage in their communities, to advocate for the services and possible resources that they need. Because when time is taken away, they don't have the time to engage and to notice that these processes are being placed to take more of their time instead of freeing up time so that people are able to engage socially, and then also maybe take a class, on learning more about how to build this, digital access, and being able to learn a little bit more about what the services provide. So yes, there are systems in place that have provided and have improved a lot of what we do and our communities do on a daily basis. And specifically when we're talking about public services, that still needs a lot of work. And I'll give you an example. One of the examples provided to me in conversations with our CHW is that folks, especially older adults, are being asked to apply for Medicare and Medicaid services and reapply every 6 months. And so they might learn a process within a few days, but then come 6 months from now, they need to reapply again. And so that is the thing. These are the barriers that I wish our systems would know, that it takes time. It takes a lot of people's time to be able to do that, because now they have to start over again. And so this is something that I feel needs to be more of a discussion on, like, how do we build even equity within our community members' time, so that they're also have easier processes that will help them and enhance their quality of life. Because as people, everybody deserves an excellent quality of life, not only specific groups of people, but everyone does. And so this is what we do. At the heart of what we do, at the heart of MHP, at the heart of our community health workers, is to be able to limit the time that people engage in trying to access these services, and more time in learning and enhancing their skills in order to access telehealth services, because that's very important. And now Medicare has been reducing the access for community members to get telehealth services, and Medicare is declining some of these health services, and that is affecting our community. So these are things that systematically are being placed that is also challenging for our communities.
Yeah. Yeah, it's interesting too, right? Because I feel like these systems are supposed to help us and supposed to make it easier to navigate, but what we're really seeing, it's making it a bit more comfortable or more complicated for folks to actually navigate these systems. And so, Presley, to you and folks, if you guys have any questions, please feel free to drop them in the Q&A or in the chat, and we'll make sure to get to them. I see one, and I'll make sure to ask in just a few. But Presley, who do you think is being left out, at least in the workforce side of it, sort of the workforce programs, because they don't meet that baseline that you're talking about, and as it relates to digital expectations?
I think that we are unintentionally leaving out people, and the ones who could actually benefit the most. So Daryl is here, Monica is here. I would say definitely older adults, individuals with limited English proficiency. And on the workforce side, with the Goodwill community that we serve, also individuals who work in manual labor, those coming from work environments where digital tools just weren't part of their day-to-day tasks. So that it's not always a lack of ability, right? It's a mismatch between how programs are designed and the realities people are coming in with. So when digital skills are treated as a baseline requirement instead of something we build into a program, we're creating a barrier right at the entry point. So the shift for us really has been thinking about digital literacy as part of the pathway. Because when we design programs that assume a certain starting point, we risk excluding people who are fully capable of succeeding with the right support.
And Presley, a quick question from the chat here. Are you using North Star or some other digital literacy assessment for those assessments that you guys are doing?
So we have used North Star for our digital, we've used North Star for training materials. For our
Okay.
digital skills assessment, we actually created our own. And that is actually part of our intake process. So not just individuals who are interested in our career advancement training classes or just digital skills, they actually take it as soon as they walk in the door before they enter any of our programs. And so if that's something people are interested in, I'd be happy to share it with Eli, who could then send it out to the participants as well.
Absolutely. Yeah. Yeah. Daryl, too, as we talk about these sort of barriers that have been set up for people, how much, for older adults, how much of the barriers is about skills versus fear or sort of mistrust, for older folks that you're seeing?
It's interesting because those two concepts are very closely related, right? You may have an individual who has low skill use of tech, and then it may be as a result of fear, right? Because right now, when you're in your later stages of life, your resources are finite. So then when you turn on the news, the FBI just released their report on the IC3 report, which is $20 billion stolen from Americans. Older adults represent 30% of that. That is an amazing amount of money, right? And then two, if you sometimes you may have the situation of somebody with low skills engaging in this work, and when they first start, it's the first step is anxiety because they don't have the skills, and then they see all what they can lose. And then if they don't catch the skills, if they don't understand how to upload a device, I mean a photo or an email or anything else, that kind of has an impact on their attitudes and behavior. And then if there's a series of just difficult portals, websites, and tasks that folks cannot engage in correctly or efficiently, then that really overall affects their attitudes and technology altogether, which would basically limit them, in their technology use. But if I had to pick the two, I would say fear. Fear is a big driver.
Yeah. Yeah. Here's a question for all, and please feel free for all to answer or anybody that wants to answer is where are we still sort of designing programs around assumption instead of actual lived experience?
Here I can take I can take that. Anybody who's ever done a government form online, right? That is not based on live experience. I worked very closely with my team for the EBB, the emergency broadband, then the ACP program. And then we were basically, even how it was marketed to like a whole family, but older adults could qualify. So we had to translate this awesome program to that segment of the population. On top of that, the actual app applying for getting folks to get their information, saved and then uploading them on the portal itself. It took my entire team active, 6 people, just to enroll and get people connected and qualified for the program. And we're talking about 10 people. The greatest work ever, right? That is the best 10 people I've ever worked with. But man, that was not based on live experience.
I'll go ahead and jump in here too. Online job applications. We often, again, we are assuming a starting level of digital knowledge that just is not there. So when we design our programs as if everyone knows how to navigate these systems or troubleshoot basic issues. We have people come into Goodwill all the time that they're like, my internet is working a little slow. I'm like, did you try restarting it? They're like, how do I do that? Cool. Let's start with the absolute basics here and really teach you how to not just use one specific program or not just how to navigate Microsoft. We are really trying to build these transferable skills that people can use in any setting, especially when it comes to troubleshooting basic issues. So in this, we make these assumptions, but in reality, people are still building these very basic foundational skills. And that's really where we should be starting.
I'll also chime in on this. I'm a big proponent of listening sessions and learning sessions with members of our community, and I highly encourage our systems to do that with our communities, to learn what works and what doesn't, because they are the experts and they are the ones that are going to be utilizing these services and these applications that you put out there. In order for them to be able to have easy access, we need to know what the barriers are. We need to know what it is that they need, right? In conversations, we made this realization is that as an organization, we don't like to assume that a community needs something. We like to learn from them and hear them, because they are the ones that are teaching us, that are showing us how to what is it that they are interested in, and how can we enhance, right, what they don't know and what they do know. And some basic information that we received was, right away we think, oh, let's do a computer class. Okay, so if a computing class will show you the basics of a computer and such, not everybody has access to a computer or a computer at home. That's one thing. If they're using other digital devices, what is it that they're doing? And some of the things that we found out in the field is that many members of our community don't know how to check even their text. They ask our CHW, where did that message go? I don't know where to get it. That's basic information, you see, for us, but for our community, it's something so essential as to teach me how to navigate these things. And so basic, even how do I raise the volume on my phone? Or how do it happens to me, my mother, I can show her, this is my own lived experience. I'll show her many times where the volume is and how to remove it from silence so that she hears her phone. The next day she'll ask me the same question again. And this is very common. This is something that happens. And so in order to enhance that, we are going to be creating, because at least for us here, we know that people love magnets, especially with information, whether it's a calendar or something that will remind them. So we're going to be creating some magnets with basic instructions on, here's your volume. Because this, if you have a paper, you will lose it. A magnet, you put it on your refrigerator, and you see it's thinking outside of what we typically would use. I can have a piece of paper and maybe I'll find it again and reuse it. But for many members of our community, where many people put their reminders in the refrigerator, because they look back at it, oh, this is how I do it. So it's listening, it's engaging, it's thinking outside of what we know to make sure that our communities are getting the information they need in order for them to be self-sufficient, because they don't want to be dependent so much on other people. They want to be able to do things themselves. So why not, as community organizations, as institutions, is provide those resources to our community.
Monica, you just, blew me away with that answer in a like a great sense of nostalgia too, right? Like I remember my refrigerator being pinged with all these magnets, and in those magnets was like the reminders of everybody's doctor's appointments, and it was even used like to some extent a phone book, like call this person back. And now, visiting my parents, I don't think they have half of the information that they used to have. in the side of their refrigerator? Well, because now most of it is coming into their text messages, right? Like my mom gets all of her doctor's appointments reminders into her text messages. So yeah, hit nostalgia, but incredible marketing idea. I love it, and I might steal it, and other folks should too. But tying that to one of the questions that came in on the messages is how do we find people, right? I think this is more on the outreach side, and I love it too because it's something that we've been talking about a lot. Is what's the best way to go out and find the people that really need this sort of um, uh, digital skills classes, or who do we know that needs to be connected but is not connected? What's sort of the outreach that you guys are doing, or something that you've seen work well aside from magnets? I think that was a good one.
Here,
Good. Yeah,
oh,
you can go, Daryl.
okay. I'll go ahead and start. I'm currently in Bandera, Texas, right? Rural Texas. I live in San Antonio, Texas, which is more, it's a city and everything else. But I've been taking a tour of the hill country, visiting how small communities work, understanding the social hubs in a Bernie or anywhere else. They have sophisticated systems and a government and a lot of support, as opposed to a small comfort or a Bandera, where some of these small locales don't even have formalized governments. These are just clusters of people that are living, together, and yet they're still leaders. There's institutions, there's churches, they're good-hearted people that are working together, and it's identifying with that, but also creating a trusting relationship. It's not something that you can do overnight, but it's just something that you do through requests and just through being available to help support them.
Yeah, I think with Goodwill, we are privileged because everyone has heard of Goodwill. They have all seen a thrift store. So we kind of come in with already somewhat of a rapport, but people may not know the workforce advancement side and our mission services side of the organization. So for us, our headquarters is in Travis County in Austin. However, we serve 15 counties, all in the surrounding area of Austin. And what we have really made a goal and an initiative in the past 2 years is making sure that we are outside of Travis County, because Austin is receiving all of these amazing services. There are so many more programs, but down in Gonzales, Texas, where are the organizations and where is the help? Same thing going up north, same thing going out west, out east. We are serving more than just the tech hub of Austin. So just because people say they live in Austin, they may be living in Buda. And so they may not have the same resources and the same access as Austinites do. And these outlying counties just simply don't have the same internet capabilities and the same access. And it may be more expensive because now internet companies are having to travel further, or they may have the access, but it is so slow. Or they can't fill out a simple job application. They cannot watch a video because the internet is just not as sophisticated in these outlying counties. And so making sure, again, that we are meeting people where they at, not just figuratively, but literally. So like Daryl said, actually going to those counties, making sure that we are reaching those outlying communities that are outside of these hub cities and these cities that have a lot more opportunity. Just because they do doesn't mean that the surrounding areas do. So making sure that we are meeting people where they are at.
Presley, would you mind if I put you on the hot seat here and
Sure.
maybe talking a little bit about Betty and how, you guys are using Betty to really meet people where they are?
Absolutely. So Betty is our mobile mission unit. Betty stands for Bringing Education and Technology to You. Her name has double meaning. Betty's also just cute. So we take her to these outlying counties, especially to our Goodwill stores in outlying counties, because stores are visible. People trust our Goodwill stores. So really pairing that connection with, yes, you can thrift here, you can donate here, but look at all of these other amazing opportunities that Goodwill is offering to the community. Even if our shoppers or the people who are donating don't need our services, they know somebody that does, because we're in these outlying counties that have these underprivileged communities who don't have access to the technology. So we're using Betty to meet people where they are and it is an outfitted van, so it kind of acts as a computer lab on wheels. So we're able to bring Wi-Fi to communities through the van, and we are able to provide trainings to individuals out in the community. So whether that is one of our job preparation classes like resumes, interviews, we also have financial empowerment classes to teach individuals how to budget. And then, of course, our digital skills classes, where we can actually provide the trainings and then provide our devices through our Earn and Learn program as well.
Love it. Yeah. So if you're ever out in Central Texas and you see Betty out there, make sure you honk. It's probably Presley driving it.
Probably may give me a wave.
Monica, did you want to add something?
Sure, yes, thank you. So part of what success, at least on our end, looks like in this digital landscape, and I want to give a shout out who's here also listening, is Hilda, one of our CHWs, who's doing amazing work in Maverick County, not just Eagle Pass, but Maverick County in general, which is part of Eagle Pass, because she's also in the outlining colonias, right, in the areas. And many of these areas are very rural, and she goes out there. She's out there when we talk about, meeting people where they're at. Hilda is out there in the community. She's meeting with people. She's creating partnerships. Partnerships are essential in building success. And so many of our partners in these underlying communities are helping us bridge those gaps. So the communities know these centers, they trust these centers, and these are the spaces that we are providing. We started doing learning sessions, right, which are being led by Hilda, because of her extensive experience working with connecting people to social services, connecting and helping people apply through the Your Texas Benefits website and application. She is now creating a learning session for members of the community to learn how to follow up with their application. How do you upload documents? How do you, know the process of how to see what your status of your your application looks like. And so she's doing that, and she's taking the time every month in a different region to do this. And not only that, but she's also partnered with some of the local financial institutions in these areas to help people navigate financial resources. Now through like building financial literacy in these communities is by supporting them on how to do online banking. A lot of people don't know that this is an option. We still have members of our communities that send money to their families in Mexico and many parts of Latin America. So how can you do it without the exorbitant fees, right, that come with sending money back and forth to members of your family? So these are things that they can learn about Zelle, about all these applications that they can actually utilize to connect with family also through this economic spectrum. And we are providing those. We partner with members of our community. Hilda is the lead on this, and she's partnered with members of these community of our community to provide this service to our communities as a resource as well, and also as a financial literacy. So this is what success at least looks like on our end with what we have heard our community. We are listening, we know your needs, and this is what we have been doing to move the needs in our community forward.
Yeah, I love that too. I think just shaping your programming and the services that you provide to what you're hearing is very important. If y'all don't mind, I'm going to move over to a question that came in on the Q&A chat box. And folks, if you guys have any questions, please feel free to drop them in the Q&A box or in the chat box. But this one I think is mostly for Presley, but anybody feel free to jump in. So Brendan said, as someone who just graduated from college recently and grew up in this sort of digital age, it can be hard to keep up with the best digital job application platforms and how important LinkedIn really is and what's the best approach in job hunting. Um, their question was, how would you all suggest on helping communicate to applicants and the workforce what platforms are reliable and how they should interact with them? Um,
Yeah, that's a really great question. So at Goodwill, I've talked about our career advancement training classes that focus really on job preparation. So working on your resume, interviews, cover letters. We have one-on-one courses that we offer. We have mock interview classes. And we actually have an entire class dedicated to Indeed and how to navigate that platform. And so Indeed has been a wonderful partner of Goodwill Central Texas, and our trainers actually walk through all of the features that Indeed has to offer, including their AI features, and how they can actually use those features to transform a job description into ready to use resume bullet points. So that way we are matching what we like to call the wanted ad, the actual job description and what they're looking for. So your resume is now matching what this employer has asked specifically for. So that's something that we do specifically when it comes to job application platforms. So when we also teach our Google Workspace class, we also talk about Google Jobs and how that platform works. So we may not necessarily lay out like an entire list of, hey, these are the best platforms to use, but we do give them different ways on, or I would say different platforms, and then give them extensive information on how to actually use them and how to use them to their benefit as well.
Yeah, good. Yeah. Another question for all three, but I think I'm going to invite Daryl to go first, if you don't mind, Daryl. What do you think success in digital adoption actually looks like? And like, are we measuring the right things when we talk about these sort of successes?
I know through the metrics that we do through our classes, we do surveys, we've done posts, we've done a lot of third-party research studies along with, different universities. I think it's attitude levels, right?
Hmm.
It's confidence. It's making sure that people are confident. It's less fear-based, gauging how people are. Also, we've had other studies that, or at least within surveys that we've done to see how much money people have saved, but going back to online banking, or how many jobs and things have people have put out, as they apply. Um, I think that though we're headed in the right direction, right? I kind of feel like a lot of the innovations, if you look at how computers and mouses and starting up and that whole boot up process is now shifted to a smartphone. It's very intuitive now. It's touching, it's swiping, it's up and down. The advent of this voice activated technology, this is allowing many people who are differently able connect to this internet, and also it's making all of our lives a little bit easier. When you use, for example, like an AI, whatever application you're using, before you would put in a search thing on Google and have 10,000 results plus a banner and all this lights and everything else moving around. You can put in the exact same question in like a Gemini, and it's nice, it's clean, it's A to B, and it's very simplified. So, like I said, more work's to be done, but I do feel that we are going in the right direction.
Monica, Presley, did you guys want to add anything on that end?
I may have answered that question earlier with the
Yeah,
comment I
yeah.
made. Yeah. Well, I mean, just what I was sharing with you all is making sure that those needs, especially the digital needs in our communities, are being met, and that is through basic understanding of what those needs look like for those specific communities. One colonia is going to be very different from another, and so making sure that those needs are being met in each of those areas that we're serving. And similar to what Presley, I love the Betty access. It's wonderful. And we have our own Betties, which is our community health workers that are out there in the community, really, meeting people and where they're at. So.
Great. Oh, we have one question here. We're coming up to the last 8 minutes or so. What do you all think what do you all think is AI's role in digital equity, if any at all?
Take a stab at this one. So at Oats, we're technology enthusiasts and we're age reframers. We believe that older adults, that's the one thing that we all have in common, is that we're all getting older day by day. There's nothing we can do about it. And it's a good thing, right? Even when at the very end, there's still some positive aspects of having this finite time together. The other thing about being a technology enthusiast is that we believe that technology is positive, including AI. I look at it as a disruptor, right? If you don't hear very well, you have a hearing aid. If you don't see very well, you have glasses. AI is a powerful tool that can simplify very complicated topics like a prescription, a diagnosis, combinations of medicines. So I frame it as it is very positive and it could help people, especially those that have disadvantages. However, at the same time, we have to be very real, especially within, as I mentioned before, $20 billion stolen from Americans. We've got to make sure that we are framing it to be like, you have to be always knowing, going back to the job resources and Google Jobs, it's going to those trusted resources, those trusted sites, and then knowing what information you should share and what information you should not share. But I feel it's positive. I think it'll make our lives easier.
Yeah. I have one last question before our very quick rapid fire, if we could get to it. For all three, what sort of approaches have not worked?
I'll take a stab at this. I think that specifically talking about like our Learn and Earn program, so I think we underestimated the amount of people who would want a device without knowing how to use it. And so really taking a step back and saying, okay, what kind of requirements in this Learn and Earn program are we actually going to implement? So that way we are not only providing access, but now we're providing access and knowledge. So that way individuals can independently use their devices and successfully use their device. So I think that that's something that we very quickly realized, okay, we need to readjust. We need to accommodate what is happening right now in the program. And as far as our actual curriculum goes, I think that that's something we are constantly looking at and adjusting to today's day and age. So, for example, Indeed Lab, like I talked about, our class Indeed Lab that really walks through how to use Indeed, it used to not incorporate the AI features that Indeed now has. So making sure that we're just keeping up with the times and making sure that everything stays relevant and important to the clients that we serve.
Good deal. I do want to get to the last rapid fire, so if you guys don't mind getting into this last question, and I'm also going to share my screen here, which will have these incredibles individuals' contact information. If you guys at any point want to reach out or get connected with any of these folks, please feel free to do so. So in a sentence or less, if you guys don't mind, what's one thing that you hope this audience will do differently or think differently about, or just a takeaway that you hope folks will take after today's conversation? We'll start with you, Daryl.
Just to remember, when it comes to digital literacy, ageism, right? We always kind of focus on the youth, the energy, but when I ask the libraries, when I see who's the ones who are getting the questions, who have the most, who need the most help, it's older adults. It's just, just keep that in mind. Thank you.
Love it, Monica.
For us, it would be like stepping back and looking at eliciting actually what are the community needs. That is the main thing, is not assuming that a community has access to certain resources or that they need certain resources in that particular community, but actually asking and finding out, working with other organizations like ours or people who are already doing the work in those communities, and providing that guidance and support so that there is trust. And not only that, but that the resources that we are looking forward towards specific populations or groups of people is actually truly accessible, and truly understandable. Taking the time to inform, that is something that is very important. Inform and help our communities be self-reliant in that process, and access these digital services with confidence.
Presley?
I would say that one-time training isn't enough. Digital skills require ongoing support. So we need to fund for that. We need to design for that. So that way we are setting people up for success even when our programs end.
I love it. Great. Thank you, Daryl. Thank you, Presley. Thank you, Monica. Thank you, everybody, for joining us. A great call, great conversation, and I'm excited to stay connected with everybody. Of course, no webinar is complete without a survey. I'm going to invite everybody to take the survey after this call. We love your feedback, and we would love to stay connected. You guys have a great afternoon.